What scared me the most was that I was going to be 45 years old, and that's the onset of diabetes for obese people. And I was reaching that deadline, and that was my biggest fear. And with my family, I want to be there for them. My daughter's 6. I'd like to be there for her wedding or graduation or whatever. You see that this happens a lot, that people don't reach that age. So I feel that with this, I will be able to be there for her, for all of them.
Aches and pains have become Lisette Kring's everyday companions. Now, after years of being limited by her weight, Lisette is about to undergo weight loss surgery, also called bariatric surgery, in the hopes that this one procedure could alleviate almost all of her health-related problems. But could it really be that simple?
Bariatric surgery is incredibly unique because it's the only surgery we really do that takes care of more than one medical problem at a time. Obesity affects all different organ systems, and by getting rid of the obesity, we can help a lot of different medical problems.
I feel like this is preventive medicine. People say that you don't look like you need to lose that much weight, but yet in reality you do.
Now, watch as a Miami wife and mother undergoes a dramatic procedure at University of Miami Hospital that will leave her with an entirely new lifestyle. At a time in life when most people are settling down, Lisette Kring has decided to radically change everything.
I know Lisette is very committed in changing her life. She'd finally reached the point where she knew that if she wanted to get into her 50s and 60s and be active, that she needed to make a big change.
I feel that this is going to be a first step for the rest of my life.
We'll also visit a patient who had bariatric surgery more than a year ago and witnessed the dramatic changes in his life.
Within the first week when I went for my follow-up visits, I was off my insulin pump, I was off all the diabetes drugs, and pretty much off of everything else that I was taking and it's been that way now for 15 months. I'm pill-free and drug-free and feeling great.
Hello, I'm Jay Adams, and this is Breakthrough Medicine from UHealth, University of Miami Health System. Every year in America, $147 million are spent on obesity-related conditions, yet the rate of obesity continues to rise. It's estimated that 70% of all adults in the United States are overweight. Of those 9%, about 15 million people are morbidly obese, meaning their weight is more than 20% above their ideal body weight. Even more shocking, 16% of children are morbidly obese. We may think of excess weight as usually linked to high blood pressure or joint pain, but the health risks of morbid obesity are even more critical. Heart attacks, diabetes, cancer, even stroke. So if diet pills and drinks aren't effective, if counting calories just doesn't work, what is the answer?
Ever since I was 5 years old, I saw myself, I have pictures of being in the little uniform and being overweight.
Miami native Lisette Kring feels like she's been fighting her own body since she was 5 years old.
I have been overweight most of my life. It's always, oh, if she just lost a few pounds, if this and that. But you know, after I've struggled with my weight, I've yo-yoed, and every time I lost weight, a significant amount, I got pregnant. So 5 children, 4 C-sections later, and I'm done with having children, I'm saying, this time it's for me.
People do diet and do diet relatively well. The problem is maintaining the weight loss. Dieting is more of a factor of willpower. Can you do what it takes? Can you make the sacrifices to lose some weight? Maintenance of it in the long term is a little more difficult because at that point you're fighting your body's hormonal responses to regain weight to put you back to where you were.
Dr. De La Cruz Munoz is medical director of the Bariatric Surgery program at UHealth.
Over the last 10 years, bariatrics has exploded. And the big reason for it is that laparoscopy has really helped bariatric surgery become the mainstream, where people are viewing it as a viable option. Bariatric surgery is also much more important now because we're realizing that obesity is a medical problem and not a social issue.
After consulting with her doctors and her family, Lisette has finally decided to undergo weight loss or bariatric surgery. It was not an easy decision.
When I decided to do this and I started to tell people, some people that were totally against it, that some friends that said, oh, that's a dangerous procedure, you can die, that things can happen. And however, the funny part of it is that the people that haven't had the procedure done, that don't understand, are the ones that would say that. Now, everybody that has had the procedure that I've spoken with are totally elated about it.
Lisette is special because she's a very energetic 44-year-old woman. She has 5 kids that she needs to keep up with. She works a full-time job, a health-related job, and she just wanted to start changing. She's not sleeping well with, we think that she's got sleep apnea. She has some of the other comorbidities associated with obesity, and she'd finally reached the point where she knew that if she wanted to get into her 50s and 60s and be active, that she needed to make a big change.
Patients must prepare themselves emotionally as well as physically for the surgery. This means that before the procedure, Lisette must change the way she eats, even the way she thinks about food.
Well, the brain is a pattern repeating machine. It wants to keep doing what it's always done. So once there's a routine established, an eating style, a lifestyle established, it's very difficult to break that pattern, particularly since it's lasted for people's entire lives often. So changing that pattern requires a lot of effort, a lot of different tools, and probably the most powerful tool is the bariatric surgery. Through the surgery, people really have a window of opportunity of 6 months to a year when they're not able to eat the way they used to. They're not able to consume the kinds of foods or the amounts of foods that they're used to. So it's a golden opportunity to be able to alter those patterns and kind of set that as the new default setting, so that that becomes how they interact with food rather than the old patterns which had been so well established.
We need to help their mental aspect in terms of their mental relationship that they have with food, whether it be dependency on food or the incorrect perception of dieting and portion sizes and volume control. Ms. Krings has already initiated some portion control, some better food selection. She started exercising a little bit on her own, and she's dropped about 20 pounds since we first saw her.
On Wednesday morning, I'm gonna come in and get the gastric bypass procedure done, and I feel that this is going to change me positively. It's going to be a new and different direction.
When we return, we'll follow Lisette's surgery at University of Miami Hospital as she chooses a new way of life and a new way of living. We'll also meet another Miami resident who is now 17 months past his bariatric surgery.
In my life, I didn't think that's what I was going to do. Today, I know it was the right thing.
This is a new day.
I think diabetes is one problem, and I think heart disease is another. Other than that, to be honest, it's probably about the limit of my knowledge.
Heart disease, diabetes, blood pressure issues, high blood pressure issues, and just overall unhealthiness. I mean, it's so bad for your body. You can have knee problems because of extra weight you're carrying.
There's a series of problems that I understand could happen. One of them is obviously high cholesterol levels. The heart starts suffering, lower limbs start suffering, the whole body starts suffering.
Buenos dias. Good morning.
Good morning.
How you doing?
Good.
You ready to go?
Yeah, you?
I'm ready. Because of her weight, Lisette faces some complications in her daily life. She has daily pains in her knees and in her hips. Her back is hurting, where she occasionally needs to take medicines for that. I'm sure that this procedure is going to help with those incredibly. Just taking the weight off mechanically helps all the joints and helps the lower back to resolve the pain, and I would expect her to get off all the pain medicines for those types of aches and pains.
That's exactly why Miami native Lisette Krings has turned to UHealth. After years of failed diets, pills, drinks, and weight loss programs, she's ready for what she believes is her last chance at a new life: laparoscopic gastric bypass surgery.
I'm feeling pretty excited. I'm not feeling nervous at all. I'm just anxious to get it over with.
Today, we're going to be operating on Lisette. We're doing her gastric bypass after she's gotten all ready. She's gone through months and months of preparation for this, where she's gotten psychological evaluations, nutritionists to teach her how to eat right, going to post-op support group meetings, and finally she's all ready to go. We put her on a pre-operative diet for a couple of weeks. She's lost some weight, so that hopefully will shrink her liver a little bit, make it easier to get this thing done, and hopefully we'll get her moving up and walking around later today.
In normal digestion, food passes through the entire stomach and then the small intestine, where the body absorbs nutrients and calories. Bypassing much of the stomach and small intestine will allow Lisette to eat less and feel very satisfied with these smaller meals.
Following bariatric procedures, with the reduced amount of calories that patients will be consuming, it is necessary that they take additional supplementation, usually for the rest of their lives, to prevent any nutritional deficiencies associated with the reduced amount of calories that they will be consuming.
So we're going to go into her abdomen laparoscopically, which is using these long instruments and small little holes, rather than having to open up her abdomen completely. Doing it laparoscopically allows us to do it actually even a little bit more efficiently, a little bit quicker than we would if we did it open. And it also allows for a much quicker recuperation for the patient. Most of these patients go home the next day after only spending one night in the hospital, and they require a lot less pain medicines, they require less recuperation. We get them back to normal activities very quickly. Compared to if they did it open, they wouldn't be able to lift anything heavy for about 2 months. So now we're going to find the small intestine, and so this is where the business end of the whole surgery goes. So we're going to separate the 2 pieces of intestine with the stapler. Okay, clip. So you saw the stapler stapled and cut. So you see now what was 1 piece of bowel is now 2. So it's the same stapler. We can now join. There we go. Join these 2 pieces of bowel together. And when we join them, this union of the 2 pieces of bowel is called an anastomosis. So when we bring them together this way, this is going to be where the gastric juices and the pancreatic juices combine with the food that she eats, and the digestion begins at this point, not necessarily at the stomach up above.
The surgical team is halfway through the procedure and is about to create a small pouch in Lisette's stomach.
There are different ways to go at the stomach here. I try to come at it very close, not to disrupt the blood vessels that run in this fat, and this white little line that's the nerves that run in the fat, so that the normal function of the stomach can continue as best as possible. There we go. And this is going to be the stomach pouch that she's going to eat with later. This is what we call the gastric remnant, the leftover stomach, that continues to function in terms of making acid and helping with digestion, but it just doesn't see food. Okay, so now watch. The stapler has now separated that bowel and stapled on the 2 sides to close the 2 ends of bowel. So this is where I'm closing the defect that we made in order to put the staplers in, so we can complete our anastomosis or complete the union. And actually, a lot of people just finish right here. They don't do any more than this because we've already closed it completely. And so now, once we close this, then I'm going to put another layer on there just for safety in a few seconds. But all this does is close the hole that we had already made a second ago. Okay, so now we're going to test it to make sure it looks good. So she's going to inject some fluid, some water with some blue coloring on it. Go ahead. Into there, we're going to blow it up like a balloon and make sure that we don't get any leaking of fluid out. So see, there it is, nice and tight. Down, okay, look up. Good, that looks very good. So we're essentially done. Everything went great. Her surgery went really well. We couldn't have asked for anything better. Now the big thing is just we got to get her up and walking around this afternoon to help avoid blood clots and pneumonias, and hopefully she'll be able to get out of here tomorrow.
Just hours after entering the hospital, Lisette's new way of life has already begun. When we come back, we'll check on her progress, but first, we'll meet another bariatric patient who has experienced a remarkable change since surgery.
I've been committed to working out and doing exercise and watching my nutrition, seeing my nutritionist, seeing my trainer, doing all the right things to maintain a very strong, healthy lifestyle. And I'm strong, I feel great. I don't think I've ever been this strong.
I think the growing rate of obesity in the U.S. has grown in the past 10 years just with all the size of portions alone at restaurants. I mean, if you look at Europe, their sizes are so much smaller.
It's, to be honest with you, it's because of portion distortion here. The meals are too big. They're all too big. And that, I think, is the main problem.
I had gastric bypass almost 4 years ago. I was 300 pounds. I'm down to 150 now. It is hard. I'm not gonna lie, it was hard. There were times where I get very frustrated, but I'm healthier and I'm in a better state than when I was before.
For some, bariatric surgery signals the end of a long quest to achieve permanent weight loss. For others, like Jim Behar of Miami, it's truly a matter of life and death.
About 10 or 12 years ago or so, I found out that I was diabetic, and I thought that was just a fact of life. It was all over my family. And sooner or later, over the years, other complications arose: liver disease, kidney disease, high blood pressure, cholesterol, triglyceride, and the diabetes was sometimes managed, sometimes out of control, but more than not out of control. I ended up on an insulin pump, and that was when I wanted to draw the line and find a solution for myself, something to save my life.
Like more than 200,000 people every year, Jim chose to undergo bariatric surgery. He turned to the specialist at University of Miami Health System.
I heard about the UHealth bariatric program from my endocrinologist. He was very instrumental in telling me that there is a solution to diabetes. It's not the most endorsed solution because medically there is no surgery to fix diabetes, but he said that he's seen plenty of successes with people that get bariatric surgery, and because I was overweight, he thought that the doctor would look at my case and look at all my other underlying circumstances and agree that bariatric surgery was going to be the solution for me.
It's been an emotional journey for Jim, but the greatest transformation has been not only to his weight, but his overall health. He believes that in 2 short hours, the surgeons at UHealth added years to his life.
About 6 months or 9 months before I went to see Dr. Dela Cruz, I was told by a nephrologist that my kidney was like that of a 90-year-old man and that I had very short time to live. And in today's day and time, I have no kidney disease. And I pretty much owe that to the weight loss and the metabolic changes in my life that happened as a result of the bariatric surgery. Just before surgery, my top weight was 248 pounds. I weigh 180 pounds today, and I've had an amazing metabolic change in my life. I am no longer diabetic, I am no longer hypertensive, I no longer have cholesterol issues, triglyceride issues, kidney issues, liver issues, diabetes. I mean, I had 7 diseases go away immediately post-surgery. It's a relief. I'm free, I'm liberated, I have my life back.
I'm happy that we were able to do the surgery for him because we know that by getting rid of these medical problems, we've made him healthier, and it's been shown that the surgeries can help resolve the medical problems in the majority of patients. Over 84% of diabetics get off all their medicines after bypass. Over 70% of patients that are taking high blood pressure medicines get off all those medicines. So these surgeries have already been shown that they make people thinner, but they also make them a lot healthier.
Not long after surgery, Lisette is recovering well. She's still on her way to meeting her goals, but enjoying a new life with her family and a new outlook.
The surgery went great for Lisette. The operation went very smoothly. It was under an hour. She was upstairs and walking that afternoon. She went home the next day looking as if she'd just spent the night in a hotel. Her medical problems have all gone away. She's moving without pain. Her reflux has gone away. Her sleep apnea is gone. and her attitude has completely changed. She's much more positive than she was before. So we're seeing all the perfect changes for her afterwards.
Since my surgery, which was 8 months ago, I've lost over 100 pounds. Initially, when I went into Dr. Dela Cruz's office, I was weighing 280, so now I'm at 161. My feelings right now is like I'm on a high. It's just a euphoric experience. It's wonderful. I feel energetic. I feel like I can do just about anything. I definitely feel a lot younger. I feel a lot younger. People say I look a lot younger. When I look in the mirror, I definitely like what I see.
Only 9 months after surgery, Lisette has already lost 100 pounds and continues her commitment to a healthy lifestyle. She works out regularly, watches portion sizes, and now is a success story for others participating in UHealth support groups and seminars. These informational sessions help answer questions for people considering bariatric surgery. Just as Lisette did, they'll learn about the surgical options and meet some of the doctors, nurses, and nutritionists who are creating success stories across South Florida.
I'm a general surgeon and I do lots of different types of surgeries, but bariatric surgery is the most gratifying surgery that I do. We develop a lifelong relationships with the patients and their families. They come back in and we see them getting healthier, we see them getting happier. We watch their life changes as they give birth and add family members. So it's a very positive atmosphere all the way around.
Oh, my experience has been wonderful. Everybody's very attentive, they're very organized, they let you know what you need, or they even ask you if you need anything. They've always been on top of everything. My advice to people is not to hesitate. Do not hesitate. This will change your life. This is your most important moment, and if you lose and choose not to do it, it'll be the biggest mistake of your life. So my advice is to do it. Change your life now.
The advice that I can give to people that are considering bariatric surgery is become educated about it. They should come, see a bariatric surgeon, discuss the different options, and figure out if it's for them or not, and not just go by what they hear on the street.
I walk into my office, and I walk into my supervisor's office, and she's like, you know, I'm very proud of what you've been doing. There's something about you. She's like, you glow. So, I glow.
To encourage the long-term success of bariatric patients, UHealth provides a comprehensive approach, including support groups, nutritional counseling, and exercise programs. To learn more about bariatric surgery options at UHealth and the pre-operative requirements, you can log on to our website at uhealthbariatrics.com. I'm Jay Adams. Be sure to join us next time on Breakthrough Medicine.